and you fill a lot of forms. These forms, the Office of Human Resources are meticulously followed. If something misses, you will retire and it will take you time to get your, even a gratuity, leave alone pension.
No, but filling of those forms, for me, I would not say that that is an application for pension or gratuity. No, it's not an application, because once I retire, that would mean that if these forms are not applied, you don't remove me from the payroll. I will keep there because the forms have not been what? Have not been considered.
Chair, what I mean, the government system should be automatic.
Yeah, definitely. That's
that
what
somebody turns 60, that person just migrates to the other system automatically. There will be no waste. You know, this gives a lot of chance for these people to be at the mercy of human resource officers, who sometimes choose to pay them or sometimes may choose to delay them depending on the moods at the moment. Because so I think we really need to push for.
In this, it looks as if there is an option. There is no option. Once you get 60, you must be retired. So why do you want me to fill those rigorous files and forms? Because it is automatic. When I get 60, they even remove you from the payroll. You will be deleted. So if you delete me, what next? So I mean, migrate. You remove me from here, put me somewhere else. Do I have to really apply to be a pensioner? Why should I apply? Except under peculiar and exceptional circumstances. But it would have been automatic. I get 60. If there is no any circumstances that are exceptional, switch to the payroll, to the pension payroll. Make some of these proposals. You know, this is the same thing that happened to these bail fees. Why should I pay my money and then come to beg you, you know, please pay me back? As you get my money, also ask for details of where you will put it, just in case I win a case or lose it. You see? So some of these things, you know, the challenge you have in this country, it looks as if giving you a better service is optional and is a favor. It has never been a favor. It is in our interest to ensure that we give timely, quality services. Somebody sits home and just be told, you know, you're a pensioner, without walking up and down. Somebody, even at times people die without getting pension. Are you aware of that? People die without getting this money, which is pure and unacceptable. That is an infringement on someone's rights. Pension is a right, as long as you don't have any reasons of denying me my pension. So, honorable colleagues, we take note of the issue of delays in pension, though. At least for you did not have so many cases. There are those of your colleagues. HR, in regard to pension and gratuity, it should be 0 areas, if factors can allow. So, honorable colleagues, we go to report on audit performance and compliance with the relevant laws, procurement and disposal management. Failure to dispose of public assets. Why do you keep those old? You don't have space, your buildings leak, your patients sleep in tents, and then you keep old machines. What is your interest, sir?
Yeah, I just remind him I asked about the estates department and he never gave a response.
Okay.
Yeah, thank you, Chair. Thank you, Honorable. I think, allow me give a chance to our procurement officer first to shed light on this. Mr. Mita.
Thank you very much. For these assets, at the time of the audit, we had not yet done the evaluation of these assets. But as we speak now, the Board of Survey was constituted. The ad hoc Board of Survey was constituted. The valuation of these assets was done. And currently we are in the process of procuring an auctioneer who shall dispose these assets through public auction.
What is the valuation value for these assets, all of them?
Because there are very many. There are motorcycles, there are generators, there are motor vehicles, and then some other obsolete machines which are all over the compound, plus many other things.
For how many years have they been there?
These have been there for a while, but they have been collecting over time.
What is a while? Quantify the while.
About 3 years.
What does the law say when it comes to disposals? And what, I mean, you know, these ad hoc committees to constitute the Board of Survey is part of you. Who constitutes the Board of Survey?
It is the accounting officer.
Accounting officer. What had happened to you? The theater was too congested that you could not, handle some of these. The time will come to dispose of, these things will be of lower value than you estimated. And if one asked, where do you keep them? They must be kept somewhere with tarpaulins covering them. The time will open them, they're already of zero value. You will waste money to getting an auctioneer. An auctioneer will ask for more money than that you will get from the items. Or else you find 60% of the money got from the items paying the auctioneer. So what is that? And you'll find that some of these will qualify for either burning, they are zero value. They have of zero value the time will come to dispose. I don't know when the report was out. When do you intend to sell? But at times you can reach a time of sale when some of these are of zero value. But you will have hired an auctioneer who has a certain, who will do it at a fee. So much as government is not in for profit, but efficiency and effectiveness is also important.
Chair.
Yes, Honorable Oshabi.
Accounting officer, why I insist on the estates department, I doubt whether procurement can really handle all your assets, because the mind of procurement officers most of the time is about buying and disposing. They never take care of assets.
And it's not their role.
And it's not among their responsibilities. So a hospital like yours should have a department responsible for maintaining and...
But is it part of the structure?
This is why I insisted on asking. But I don't know why the accounting officer never wants to give me that answer. And yet I'm interested, and it is for your own benefit, sir.
But honorable colleagues and accounting officer, if you can practically look into this, when an item is purchased in an entity, these items are registered.
Yes.
And there is a system that depreciates them on an annual basis.
Yes.
When it reaches a zero, which value, I don't know, when it reaches a certain value, the system automatically tells you that this is due for disposal. Once anything leaves its useful life. So, Honorable Shabe, these people, which assets does he have? The buildings are self-explanatory. He keeps the titles. Aren't you the one who keeps the titles for Mbarara Regional Referral Hospital?
If we had it, would be at the ministry.
But do you even have the title for that Mbarara Regional Referral?
Not yet.
You see? You said the hospital is 90 years old.
Yes, please.
So, is that how...
Honorable,
the Wazukuru are becoming very funny. So, 90 years.
Yes, Honorable Chair.
What is happening? 90 years you don't have a title.
Actually, what happened? I don't have a clear background, but when the university started in 1989, Mbarara Regional Referral Hospital became a teaching hospital, and it shifted. It became actually, it joined the Ministry of Education. Now, the Vice Chancellor then, he embarked on the survey process and surveyed both Mbarara University of Science and Technology plus Mbarara Regional Referral Hospital. So, our land now belongs to the land title of Mbarara University of Science and Technology. They stayed with the Regional Referral Hospital for good 10 years. In 2005, it became too heavy for the Ministry of Education. So it was pushed back to the mother ministry, Ministry of Health. And it is that particular history that makes, for example, Mbarara miss on regional medical maintenance equipment workshops. When the donors were donating these facilities to regional referral hospitals, Mbarara was hidden under Ministry of Education. That's why we are still struggling. So, thank you. Yes, and what have we done? On principle, we agreed between Mbarara Regional Referral Hospital and MAST. We know where our land stops. We've had a chance to create a perimeter wall that now separates us. And we are in the process of carving out the piece that belongs to Mbarara Regional Referral Hospital from the main title of must. Yeah.
The maintenance.
Yes.
I need how do you handle maintenance of assets and equipment at the hospital?
Yeah, thank you. Can I request our planner to shed a light to these honorable members? Thank you.
Thank you, Chair. Honorable members, management of medical equipment, we have a workshop in the hospital, but the workshop can only handle equipment within the hospital. We cannot manage handling the entire region because we still rely on Chigezi, that is the Kabale Regional Referral Hospital. But what we are doing, as we get some budgetary increment, we keep increasing the allocation that we are giving to the medical equipment maintenance workshop to enable them handle the equipment in the hospital. But also management of estates, that is the renovations and all that, we are still using the same maintenance workshop, the staff that we have, but also working with the university engineer for guidance, because as a hospital, we don't have a civil engineer. So we work with the university for consultations in case we are doing any renovations. And management of estates is actually falls under the Department of Finance and Administration, but we don't have a designated estates manager, but as administrators, we are handling it there.
Chair,
Yes, Honorable.
the challenge with that kind of system is that nobody is particularly concerned. And an institution like that your problem is not only on medical equipment. There is a lot of assets that need maintenance on a day-to-day basis. And I doubt whether you can continuously manage it under administration. So it's my simple advice that going forward, you may start thinking about it. You have somebody, a department clearly responsible for day-to-day maintenance of assets, equipment, and the entire estate. And it makes more reasonability that you may find that you have so many equipment laying non-functional just because there is nobody who is responsible for that. And many institutions, you find is that big challenge that everything they want to dispose of, even with simple things that could have been worked on for the equipment to remain functional and for the benefit of the people.
Yeah, point noted, Honorable Member.
Thank you, Honorable colleagues and the accounting officer. We go to section 3, report on performance evaluation. Implementation of the approved budget. Honorable colleagues, we take note that Mbarara Regional Referral Hospital gets a budget of 17.913 billion, only serving a population of 6.7 million, inclusive of 2 refugee camps. So we take note that this budget is too low for Mbarara Regional Referral Hospital, considering the population that it does serve. So it's in our interest that we do a bigger bargain for Mbarara Regional Referral Hospital, because the area of coverage, these are 12 districts plus one city, Mbarara city.
Chair, look at their development budget.
Their development budget is how much? Speak to it. What is the development budget, Honorable Shawe, for Mbarara? No, actually, you can go in detail.
It's 100 million, Chair.
When you look at
Did I read it correctly?
Madam Chair.
Yes, Honorable Angura.
Yes, Madam Chair. Whereas the budget for Mbarara is small, and that is the initial budget was 17. When you look at the statement of appropriation on page 14, there was no adjustment. You didn't get a supplementary. And the revised budget remained the same. But fortunately enough, you had 18 billion. 18 billion is what was available to you. Where did you get the additional resources?
NTR, maybe. NTR.
The warrants were 17.9 billion. What is the difference from 17.9 to the 18?
Yes.
It's a difference of how much?
This is the budget. So the accountant should explain it to us. No, NTR is here. It's already, this is there. This is the budget. This is the budget. This is the budget.
Thank you, Chair. The only issue is that we get the release before we receive NTR. So actually we are spending money before we collect it because the NTR figure was embedded within our budget. So we first spend when we get the cash limit is includes the NTR figure, which we collect later and it's captured later, so it can't reconcile. The figure can't reconcile because it's already embedded within the budget.
Repeat that again.
Chair, maybe we need more clarification. Are you saying you are allowed to spend at source?
No, not at source.
So if you cannot spend at source, how do the amount released cater for NTR?
What I'm saying, when we make an estimate of our NTR, it's put into the budget. So as they release the budget figure quarterly, we also get part of the NTR, and we are using it.
But remember,
yes,
when you look at your revised budget, which gave you 17.93, there was a 1.4 estimated expected collection of NTR. Can you look at that?
no, I can't.
Yes. Look, you go on page 14.
No, it's where I am.
Yes.
What?
You had 1.4, which was your estimated NTR collection. It was part of the 17.
Actually,
Are we together?
yes.
So now, you didn't collect the 17, you collected 1.1.
Yes.
Okay? So where is the source of the outstanding, the additional resources that you spent?
Where do you get additional?
Yes.
Actually, this issue, these inconsistencies across all votes that correct NTR, and we had a circular, which I have a copy here. We complained.
What does the circular say, and relate it to the query in question?
The accountant, you're speaking to people who look at all votes.
Especially when you look at local government, they get the same issue. Like
Which
us.
issue is that?
The inconsistency with the budget figure and the performance, actual performance.
Now, at the end of the day, we would say, why didn't you collect your 1.4? Because we wanted that 1.4 here added on to what your appropriation would have been to give you 17. That is what we would say.
But that's the
But you didn't have the 1.4.
We
We acknowledge the 1.1. We acknowledge. But now 1.1 gives you 18 billion that was available to you to spend. Where did the excess money come from? What didn't you declare?
No,
That would have only been convenient if your budget was revised and you got a supplementary.
we did not get any supplementary. But
So
the actual figure in
maybe-
this case, because we get
Maybe
this
we would
actual-
ask our technical team to support us on that. And
Technical team, please do. That also takes us to the issue of the utilization of warrants. This 692 million brings us back to issues of pension gratuity and this HIV and AIDS research, payment of social security contributions. Can you speak to that? Because for these others,
The man of the figure.
no? Yeah. When it comes to this 692 million that you didn't spend, underutilization of warrants, that is 3.11. Can you speak to why didn't we? This is under human capital, administrative and support services, hospital management support services. What happened? Why couldn't we utilize this money?
Yeah, thank you so much. I think this exact it is. We have already explained this that let me get it right. Yes, we as I already said that one, we had a delay of the constitution of the New Health Service Commission. Then the Ministry of Public Service halted the original plan of retiring all of them after the abolition of the office. And
so even this social security
yes,
contribution is part of that?
It is all there.
Okay. Non-tax revenue, 1.4, 1.11. Why the shortfall of 270 million? What happened?
Yes, there are two reasons, Honorable Chair. One, over the time, we are getting an increase on the budget of the drugs and other consumables from National Medical Store. And as the entity receives more drugs and the patients comfortably receive the drugs, then they minimize chances of going to pay. So we had an increment on the side of the drugs and we received some good supplies. But again, in the middle of the course, we had on and off our CT scan, X-ray, CT scan, MRI, and echo. They got issues. And usually these are the most, there are three entities that generate a lot of NTR. Our X-ray, our CT scan at one point, it never had the service, and we delayed to get, there's a company called Erismith, which is responsible. It delayed. Then we have an already ECG plus echo machines. It broke down, and it created this shortfall actually of 270 millions. I'm very happy to announce that now we have all these machines working. We believe.
Chair.
Yes, Honorable.
You know, when I asked about the private services NTR, the accounting officer told us that they are wrong. Can Ugandans get free care, free services, CT scan, MRI, and echo, if we provided your target revenue out of this?
No.
Accounting officer.
Yeah, thank you, Chair. Thank you, Honorable. I don't think so. If the hospital got extra 1.4, we can never provide free service to all of them. Actually, what we are calling NTR, it is still sort of cost sharing. And because of the service, the servicing of MRI machine and the CT scan is very expensive. How much do we, yes, Mr. Auditor, how much do we spend?
Accounting officer,
yes.
Before we go into how much we spend, every financial year you have a budget to service those machines. My question, if money is provided to service those machines, can Ugandans get free service of CT scan, MRI, and echo?
Honorable MP, you want to answer? Yes. Can I request somebody to also add a voice? Thank you.
Thank you, Honorable Member. If I look at, let's say, the MRI and the CT scan, actually their utilization is almost like a moving kind of an average, whereby with the coming up of a CT scan, that is the CT scan technology and the MRI, you see even the number of patients every year keeps on increasing. Even if you gave us the 1.4 billion, if let's say a number of patients looked at last year who sought for CT scan services versus the ones that we received this year, they have kept on doing what? Increasing. And also if you look at the aspect of even when it comes to also the clinicians, when it comes to the need, the request for these services also keeps on increasing because of also the nature of disease.
Can I simplify the question? What does it take for Ugandans to receive free services of CT, echo, and MRI?
If you availed all the required consumables.
Can't we budget for them?
they can be budgeted for. But there is one aspect that you need to also understand, that when it comes to CT scan services and the MRI, if it's like the MRI, maybe case in point here, it's originally this would be even monopoly for the national referral. It's a privilege that as a regional referral we do have it. Actually, when it comes to NMS does not provide consumables for the CT scan. We always have now to use that other and the cost sharing mechanism first obtain the consumables for the MRI and the CT scan. So that means it's literally hard for us to budget for them under the NMS because they are not provided for there.
Chair, whatever we budget for, even National Medical Store can be asked to provide for those, you call them consumables. But Chair, why I'm insisting on this, many Ugandans miss out. They go and die because they can't afford some of the machines that have been provided. Many people, just when they tell you that the cost of a CT scan is this, they just give up. And you are aware many go home and they choose to die. When you look at the money you're generating out of those, it would have been much better if we budgeted for it, money is given to you, and a free service is given to so many people, and their lives are saved. But when you say it will be a monopoly, by then the private clinics will not work. My brother, we are not here to leverage the private caregivers. I know people who can afford those services can easily go there. Even when you have yours free, they will go and pay. But I'm minding this person who cannot afford. Can we provide it free? And that's the mindset we need always to be pushing, Madam.
Honorable Shabe, when we are interacting with a team from Chirudu, they said, and even from the Mulago Women Specialized and Neonatal Hospital, they said they have a waiver committee. And 80% of the category that they do handle cannot afford, and they have many of those that they waive for. And that is an indication that most Ugandans cannot afford some of the services that we do give. We know it's expensive to maintain these machines and so on, and these others. But one would ask, for example, the Honorable colleague was trying to ask in a perspective of we get 1.4 billion. Can't we try to reduce on other areas of wastage so that we can invest better in some of these areas that can afford to, it's a benefit for everyone. So these things of the private sector will not make money. The private sector subsidizes government where you have a shortfall in. So for them, they come in because government cannot provide. Even for those that want quicker services, they go to private. That's why you also have the private wing. People opt for private than general because they know you can get a quicker service. But still, that doesn't mean that you don't give a quick service in general, you see. So what we are trying to look out is, can we reach a level where this country can provide somehow affordable and reliable medical care services? Because now if one would ask how much does a CT scan cost and who sets these prices, is there a policy that when you go to Mbarara, a CT scan is say, you'll give us the price, and when you go to Kawempe, it's also the same price? Is it uniform across board? Yes, Honorable Bangura, you had something to say?
Thank you very much, Madam Chair. But maybe going forward, we would also request the entities and especially the hospitals that we are trying to emphasize on how services can be given to our people if resources were provided to you. Would it be possible for you to decompose for us? Well, decomposing in your side is a different term, but decomposing for us is also a different word for to break down. That's actually to break down. To break down how much we are receiving from the private wing. Because, Chair, you will recall when we were interfacing with the Kirudu and other medical facilities, you raised the same thing, that if we gave you that NTR, would you give our people free services? But they also told us that would be possible, maybe even with an increased budget. However, how will they manage those who want to jump the queue? So it means it is us here who are causing this NTR, because we want to at times shortchange the long queue you want to jump. So can you create a line that is specifically for private, those who can afford, how much are they affording? those who cannot afford, such that we know of the 1.4 billion, how much has come from the poor and how much has come from the have, such that we are able to see how to move on and support you in budgeting for our people to get the services. And you know why our people come to you, including those who have. You happen to have the professionals that at the times the private medical facilities don't have. So divide that for us.
Honorable Wanda and Honorable Angura, and a queue anywhere is bad practice. No one would want to queue. That's why you are given timelines that when somebody comes to Mbarara, at least you should not exceed this time to see a doctor. So whenever you talk about queue, it's bad practice. And it's up to them to avoid that queue. To whoever, goes to the hospital, whether you're a VIP or not, a queue should not be seen to be there. The reason as to why we are looking to issues of understaffing, let's have the staff so that we reduce on the queue. And I mean, somebody goes to the hospital when they are sick. Being in the queue is also another mental and, it affects the person. Yes, Honorable Wanda.
Thank you, Honorable Chair. Honorable Angura wanted a categorization or a breakdown on that amount. Honorable Chair, I'm quite concerned from the presentation of the director. This amount is actually largely from cesarean section. When you were talking of the NTR, that surge from the cesarean section, is it my understanding, or you also
now
confirm
we can give
that?
a breakdown of the NTR. Where did we get the money? What were the sources? Where did we get the money? Let's get those details. Where did you get the money and how much? Because when you say C-sections, the reasons as to why we increase in NTR, I will also come up and say that is very unacceptable. Even the 500 they were talking about, we are not supposed to pay that money. When I go to a government hospital for a C-section, it must be free because we pay the doctors. So that bribery, that is like.
So, Honorable Chair, I'm highly interested in the breakdown.
Let's
of
get
that
where is the breakdown for the NTR?
1.
How do we get money? Do we have it? When we go to the financials, do we have a breakdown of how the NTR is got? If not, you are going to give us a breakdown of how do you get that money. In any case, you are not there to collect money. Your mandate is to give these services. Collection of money is an addition because we have to repair the machines and give our people quality service. But that's not the reason as to why you have Mbarara Regional Referral Hospital. So, honorable colleagues, go to page 37 of the accounts so that we can see the sources of NTR. Accountant, speak to those of your sources, read them, and miscellaneous revenue. But is this detailed sale of goods and services? It is too summarized. It doesn't give the details of where we get the money. We are interested so that we can see how best our people can get a free service. When we were with Chirudu, we looked at dialysis, and you look at them getting, the whole institution gets 976 million throughout their NTR, and we said, why can't we provide free dialysis services? So those are things we look at. You weigh, So you need to give us details of your sources of NTR before we leave. As we handle these other areas, the accountant can see how best we can get that information. Delivery of services from implemented activities. We have this delay of the construction of the 32-unit staff house. When was this contract awarded? How far have we gone? Where do your staff sleep? Do you hire for them a space for accommodation? If not, do you give them allowances for accommodation? Because this project has overstayed. Update us on when the contract was awarded and progress so far, financial and physical.
Yeah, thank you, Madam Honorable Chair. Yes, can I request Mr. Omita, you've been in this project in and out, to clearly make these members understand.
Thank you. The contract was signed in financial year 2020-21. And just to give a brief background of this project, in the subsequent 2 financial years, we got money towards this project. But after that, the hospital was not allocated any other money for the completion of the project until now. And we had written to Ministry of Health because there's a time they had requested for outstanding projects that were not completed, capital development projects that were not completed. And we had written to Ministry of Health, but we still await their response. And then we also got a communication from the contractor for the adjustment in the rates because of the time that had gone. So after getting that communication, we wrote to PPDA for guidance. PPDA came and did an audit of that project and the contract, and have given a report to that effect, and have a report which was addressed to the PS Ministry of Health with recommendations. We have a copy of that report we had moved with, plus other communications we had made to the ministry. So currently, we have not yet gotten any money towards completion of the project. It's now coming to 4 financial years, if we include the current one we are in. Why? We were not given any money towards capital development
For the last 4 years?
Yes.
Wow.
32 unit staff house. What is the impact of this? All you okay, whether it is finished or not? You are happy. All you are happy. Eh?
No,
You are not bothered.
That's why we've been. No, we are bothered, Chair. And if we had these 32, 34 units done, it would change the quality of service.
Yeah. Can they show us some letters of communicating about this?
Okay, thank you. Yeah. Please.
Where they communicated to Ministry of Health, where they communicated to Finance, especially Health and Finance.
We have them here. Yeah, they are coming. Thank you, Honorable.
Because, Madam Chair, a lot of money was invested in this.
That is, if we are saying 3.7 billion.
It lays uncompleted, very relevant for the hospital, and just 5 billion is not provided to complete it. It is so unfortunate.
Where do your staff reside?
Yeah, thank you, Chair. We all cater for ourselves.
You cater for yourselves?
Yes, we reside in different corners of Mbarara city.
Which corner?
and because the available accommodation accommodates only 16 individuals.
You can only accommodate 16?
16 individuals in that hospital.
Out of 3, how many?
Out of 327. And even this one, even if that got completed, it is only 32. So if we go with the new structure of 1,260 something, still would need really more rooms for our staff
What is
members.
the physical progress of this project?
It is at a certain, yes, you can quote it.
Physically, how are you progressing?
Currently, it is approximated at around 78%.
78%, and we can't complete the 22? And they gave bloggers 5 billion. For here we need only, and by the way, they paid 3.7.
Yeah, sure.
So we need a balance of 1 point. What is the simple calculation there? What is the balance?
Something like 1.9 almost.
1.9 billion. Yeah? The people of Mbarara should do a fundraising. Tell them they can do a car wash, they can do and Wataringaya. mobilize the people of Mbarara, Abanyabuzare n'Abanyamukago. They should fundraise for completion of that. And even Choma. And these are Choma. And when one does that, they will say it is politics. But you are saving the country money. Idle capital for the last 4 years. If it was an investment in the bank, how much interest would have this money gained? And this is, you might find it was borrowed money where we are paying interest as a country for no value, being gained out of it. So the 12 districts and one city, can you run a fundraiser? You can do a car wash. People give us money. But I'm telling you, it's very embarrassing. How do you start on a project for financial years with even with not allocating a single coin to a project? Mbarara.
I'm still interested in the communications.
Yeah, let them forward.
Every financial year.
You keep gathering, sent to the accounting officer who will speak to every document. Because we must know where the problem lies. And have they allocated in the budget for next financial year,
every financial
26, 27, have they allocated you any IPF for this building? Mbarara. Now you read the title and...
Yeah, thank you. I hope they are in the order. Yes, I start with the one which was written on 15th April 2025. And in this case, we are writing to the Public Procurement and Disposal of Public Assets Authority. Here we are requesting for guidance on changes in the rates of building material.
Proceed.
Then on 19th March 2025, we wrote to the Permanent Secretary, Ministry of Health. And here, the heading is Submission of Outstanding Areas for the Completion of the 32-unit staff quarters at Mbarara Regional Referral Hospital. On 17th Feb 2025, Permanent Secretary, Ministry of Health, had written a letter to this is senior executive consultant, to all regional referral hospitals, including us, and the heading is Financing Challenges for the Stalled Development Projects under Regional Referral Hospital. It was informing the accounting officers of the regional referral hospitals. Because this problem, it is cutting across all these regional referrals. We have unfinished projects, all of us. So this was a communication from the Permanent Secretary, Ministry of Health, to accounting officers in these different entities. This is a report. I think the report of PPDA on 30th September 2025. This is now PPDA writing to the Permanent Secretary, Ministry of Health. The heading is Restored Progress of the Construction of 32 Units Staff House at Mbarara Regional Referral Hospital due to lack of funding. I think rest.
So those are the ones you have so far?
Yes, please.
We are speaking about a period of 4 years, but most of those letters you have for 2025. So is it the time that you woke up to realize that you have to write, or you have those other reminders? Because it looks as if you decided to keep quiet, you did not want to annoy your bosses, you kept quiet after year 1, 2, 3.
Is there any of your letters that you wrote to Minister of Finance?
These ones report to health. Who awarded the contract? Did you award it locally, or it is finance? I mean, the contractor was just given to you. Who sourced the contractor?
The hospital sourced the contract.
The hospital sourced the contract.
Madam Chair, even
Yes,
the districts write to Minister of Finance for
Finance.
projects that are failing. So I just want to hear from the accounting officer, when was the last time they wrote to Minister of Finance about that stalled project?
Yeah, thank you. Procurement officer, do you remember any letter?
There was previously when after the first 2 years of getting funding, we were informed that we were not going to be getting funding towards capital development, because it was we had expected that this money would come through budget allocation under capital development. But every time the budgets would they would prepare and would put something for capital development, it was rejected, and they said there was no money for capital development.
So you need to provide some of those details, because these letters are going to land somewhere in whoever is responsible for that idle investment.
Chair.
Number 2, 20, you said it was in the year 20, financial 2020-21. That is the 21 elections. That's when we awarded. So I would have thought that in the 26 elections you would be given money to complete, because this is an indication that you got this fund towards elections. Then how did you miss? You didn't lobby very well, because no, colleagues, it is an embarrassment. Idle capital of 3.7 billion. Do you know what you would do if you are given? If this money was invested in treasury bonds, how much money would you make? Idle lying somewhere. And the contract, if I was the contractor, I would be charged interest.
Chair.
Have you paid all the outstanding certificates? Do you have any pending certificate?
There are no pending certificates.
No pending certificates. So
None.
when the contractor saw that you don't have money, they stopped.
Chair, from what they presented, the problem is not with the Minister of Finance. These people have never communicated to Finance about this problem. And if when you look at the headings of the to PPDA, they are not communicating about that stalled status, and the solution is not. They are just wondering whether to return on it, they must increase the prices or the costing for it. But Mr. Accounting Officer, there is a lot of money, and the people who are getting it are not the ones who are supposed to get it. Why? Because you, who is supposed to ask for it, chose not to ask for it. There is a lot of money wasted here in government spending. I doubt whether if Minister of Finance had that Mbarara Hospital want 2 billion to complete that project, they would have failed to provide that money. When they are giving, the other day they were giving it to ranches, ranch owners, 50 billion, 54 billion. And when hospitals need only 2 billion, Madam Chair, is very, very unfortunate. I would like to encourage the accounting officer, kindly write to Minister of Finance, tell them about this problem, and ensure that at least there is a proper communication. Next time you come to the accountability committee or to your committee, sector committee, at least you present something that these are my efforts. I have not been given money.
Because we are soon to interface with the Ministry of Health. Honourable colleagues, we should get the inventory of how many projects have stalled under the Ministry of Health. We need to get the details of how many are those, because it says they were given a letter. We're going to read, so we need to know how many entities fall in the category of Mbarara Regional Referral Hospital. We are lucky that for them this project was brought out, but you might find that there are other areas where this wasn't mentioned, But I mean, the project is idle. So we are going to try to really add our voice on yours to ensure that you are given money, but it's very regrettable. An investment idle for 4 years, no more allocation. And I told you the strategic location of your area. I wonder why you don't get the money. But we shall see where the problem is. But I mean, it is quite embarrassing. Mbarara, people, you know, you don't have staff around the hospital with that number of turn up of patients. And you risk our doctors and nurses. You risk them. People move in the night, up and down. I don't know how you transport them. They move on border. Somebody who was slaughtered. A doctor. A nurse, who was slaughtered, sir, in your area? Yeah, among your staff.
Thank you so much. I don't know whether it was slaughtered. But the case I remember was a postgraduate student who left the work a bit late. There is a place called the Boma, just adjacent to Mbarara, and he met those wrong characters, and indeed was assaulted. We admitted him, we operated on him. It was a bad picture. That's the one I know.
So did he die?
No, he survived. He survived and eventually even finished his course.
So to avoid such occurrences, it's in your interest to ensure that the welfare of your staff is catered for. When you look at the distance between Mbarara, the hospital, and the town where people stay, what is the transport to that place? And when they ask for 500,000 for the surgery, I mean the C-section, don't you think those are the causes? How is one motivated to move every day? Because the salary is constant. Do you give them transport? Are they given transport?
Chair, no. We don't provide transport to all the workers.
So you don't give them transport and you expect them to come every day. So where will they get the transport? When somebody comes for a C-section, please charge, so that you can also survive. You know, we cannot fight corruption when we are fallen short of our obligation. You can never fight corruption in Mbarara Hospital. You said who pays for their accommodation?
Thank you. We all pay for ourselves.
You all pay for yourselves?
Yeah.
What is the salary of the lowest ranking officer in Mbarara? The nurse, leave alone. Even the cleaners have a right. Do you outsource the cleaning services?
Yes, please.
They are outsourced. From your payroll, what is the salary of the lowest cadre on your payroll?
That is a nursing assistant. Yes. 200. Take home.
200 paid to who? Which level is that? You be on record.
It's a U8.
Which categories, which kind of staff fall under U8?
Drivers, office attendants, askaris.
So the 200 is a consolidated salary. It's a package for everything. Transport, lunch, everything. It is the basic.
It is
what
the
do you
basic
mean?
salary.
The basic salary and the gross.
No, they are given lunch allowances.
Lunch?
For 220 for those ones in U8, and at officer level 330.
Hey, that's
but
a plus.
Which is also taxable.
Taxable. What's the cost of a meal in Mbarara? Lunch, an average for a common person. What is the cost of lunch, so that we can know that that is also adequate? Because it's not a matter of giving a figure. So that means for how many days do they work in a week? I mean in a month, and what can that buy? Is it enough?
It's not enough.
So those are the things we should look at. When you find leaders making commitment about zero tolerance to corruption, I mean, some of those said and done. I mean, the practice is different. You give somebody 200,000. How much does it cost accommodation? How much is the accommodation in your area for a lowest person? Even if you took it at 50,000, do you have a house of 50,000 in Mbarara? Do you have it? So that means they will stay far away in the outskirts. Somebody has to walk But the doctor, the hospital administrator will be tough on them. Please, why do you come late? Come, make sure you come early. So we should look at all these facts. You will be too harsh on them. Why have you come late? With your 200,000, Kirira Yambuka, 200,000, up and down. But they have children, they must take them to school. You want them every day. Do they work for some days and leave other days, or they work throughout the month?
Thank you. They work throughout the month. Apart from those people who are lucky
200
and
means
have a weekend. Just
200 means how much do you give that officer per day? You compute. Every day your officer gets how much. So that we can know the cost of living in this country, and 200,000, how much, how many days do they work for? We are seeing how best to protect the gains. We want to protect the gains, we want to fight corruption. How much, sir? You need to be on record. This is your question.
Yeah, thank you. It is 6,000
a day.
Yes, 6,600.
6,600.
Yeah.
That's the money we pay to your drivers and cleaners per day. An hour, every hour, how much do you pay?
If he works for 8 hours a day, that's 825 shillings.
8,000?
800.
800.
25 shillings.
So what? 825 in Uganda here per hour. 800. How much is a cup of tea and
Chair,
pancakes?
you asked how much is a moderate meal in Mbarara. Maybe we can find out how much is because there is that place called the Bagumas. They serve the cheapest meals there in Mbarara. How much is a meal at the Bagumas?
Honorable Angula, be fair to the people of Mbarara. You are talking about somebody getting 200,000 and you move them to as far as Baguma, where you even need transport. No, that is for the corporate.
Thank you, Honorable. It is not cheap. It is only much. You pay 20,000 and you fill your own plate. So it is a place for people with a very intact appetite. You just pay your 20, and then you can have
Honorable Angula, somebody...
Then you invite diabetes and high blood pressure.
Somebody who is paid 825 shillings per hour. You even equate them to Baguma's place. My dear, you are giving them a rope to hang themselves. But this is the kind of unfairness we are looking at. You cannot commit to fighting of corruption. You cannot commit to protecting the gains. Which gain is this one protecting now? So these are the things that should come out in these genuine discussions. How do I blame somebody for asking for money from a patient? Where do I start as a leader? And what do you expect of them to do? If they don't charge money, they will steal drugs, whichever is accessible. I will steal drugs, or I will ask for money for survival. Otherwise, for you ask yourself, how do these people survive? How do they keep at the hospital? Because they have other informal added benefits. As simple as that. So to improve our health sector, we must be mindful of some of these issues. So, honorable colleagues, we proceed to 3.13, implementation of funded activities. These three outputs with 15 activities were partially implemented. I want to look at the activities that you fully implemented. How many were? We are looking at a value of 3 billion. Want to see how many activities were fully implemented and partially implemented. Go to the table. I'm looking out for a summarized figure. These three outputs with 15 activities were partially implemented. 3 billion. We are looking at lab examination to be done. We are looking at planned x-rays, number of antenatals. You are performing somehow below average. What's the cause? Yet you received the money.
Thank you so much. And when you critically look at it...
what is this planned x-ray where you have 2,740 targets and you have 0 done? What does that mean?
Yeah, thank you, Chair. The as I said from the beginning that this hospital is one of the oldest hospitals. At that moment, we had an X-ray machine, which was very old. It was breaking down almost every month until it broke down, and the technical team came, assessed it, and they said, you know, it could not stand the test anymore. And the recommendation was made that it gets boarded off. And also, the beauty is at that moment, the Ministry of Health promised us a new X-ray. So we never had service for this X-ray. And eventually, we received the new digital X-ray.
Is it operational now?
Yes.
During that time, where were people getting X-ray services from?
Yeah. The truth is, they would go to their private settings in Mbarara.
You see the inconvenience that you do cause?
Yeah.
How much is an X-ray charge out there?
If it is a simple X-ray, the average is around 30,000, but can go as high as 70, depending on the particular investigation.
How much does the hospital charge for an X-ray?
No, we don't charge X-ray services.
You don't charge X-ray.
Yes,
now
please.
you see how burdened our patients are. Just imagine for that period when you didn't have an X-ray.
Yeah.
Somebody comes to Mbarara. You know, it's not that it was public information that everyone knows that you don't have an X-ray. I come to Mbarara Regional Referral Hospital, no X-ray services. Now you are told to go to Mbarara town, you look for an X-ray. You see the cost that the patient puts in. You don't know how critical and ill they are. So, you know, some of these things are a little disappointing.
Yeah.
Very, you see the inconvenience. Somebody even, are you aware that some patients walk? Somebody walks from home to Mbarara. After that long queue, you reach to somebody who's supposed to give you a service, they tell you, not available. Then somebody has to walk. You walk to Mbarara town. That is if you have the money. But there are those who don't have. They will have to walk back home to improvise whether to sell a goat or eggs, whichever they have. Then they will have to go to town, take an X-ray, then walk to Mbarara. But we are talking about a patient.
Yeah, that's very true.
So, honorable colleagues,
but when it breaks down, then again, when we write, it also goes under some procedures to procure one, and there is always that delay.
That is in Mbarara. We can't do much, but good enough that for now you have an X-ray.
Yes, we have it.
You have
a very modern
machine.
one, actually.
Very modern one,
Very
fully
modern.
operational.
Yes, please.
We regret the inconveniences and death caused to the people of Mbarara. People must have died because of that. You can't believe, but some people died. Denial of a service, medical, you know what somebody goes through. And yesterday, it was the other day when we were with the team from Butabika, we are told mental cases have improved. You look at that man who was,
Then it is
so they have
increasing.
increased. Then you look at a man who has come to Mbarara, he has failed to get an X-ray service or a medical service. Do you know the hunger he takes home? So you have contributed to domestic violence. Yeah, I mean, these are the things. So you intubate some of these occurrences. So mental cases are caused by hospitals. You know what it means for somebody to come in, I mean, aware that I can get a service from this point, you don't get it. You don't have money, all the hunger will be taken to the children. You will beat everyone home. So some of these things, they might look light, but a serious implication to the community. People commit suicide because of some of these small things. We go to 3.2, findings from selected service delivery points. The physiotherapy ward. The auditor conducted an inspection on 18th August 2025 on both the adult and pediatric units, and he noted the following. In the adult unit, the ward receives an average of 40 patients a day. However, due to limited capacity in terms of space, staffing and consumables, you can only serve 20 patients per day. Is that true?
That's very true.
So what do you do to these others? You tell them to go home?
Actually, what they call the ward, it is not a ward. It is an outpatient unit.
It's an outpatient unit.
Yes. So when they get overwhelmed, then we repurpose. Some patients are taken to other departments and service goes on. The unit is too small. So we don't have a physiotherapy. It is this normal body physical exercises. So we don't have a particular ward for them. They are admitted in different wards. If I got muscle issues because of road traffic accident, probably I'm admitted in the surgical ward, and the team will get me in the surgical ward. If I got nerve issues because I was delivering, maybe I'm admitted in the postnatal ward. The team will get me there. So,
but how convenient is that? What would be the
ideal? The ideal would have a complex that absorbs all these people with physiological ailments, and they get a service at one point.
The entire ward has only 40 bed sheets, while some were purchased in 2016. Therefore, too old to perform its functions. I noted that the available bed sheets were not commensurate to the 100 patients that are received per week in the ward. So, 2016, how many years are those?
It's coming to 10 years now. 10
years, bed sheets. We are talking about bed sheets, They are as durable as that, bed sheets for 10 years. How do they look practically?
Thank you, Chair. I think sometimes when this auditing exercise is going on, you can't tell who is there in the department. Generally, I've been in Mbarara for almost 15 years. I'm sure there is nobody who has been in that department for 10 years. Among the people who were interviewed.
Do you have bed sheets?
Yes, we have them.
How many pairs?
By then they were not adequate, but today they have 100 pairs.
But what was the status then? Because for us we are looking at the status then.
Yes. As I told you that this is just an outpatient unit. They were sharing these bed sheets with the patients who are in wards where physiotherapists would visit them. Otherwise, there is no bed sheet that would spend 10 years.
But do you know what it means for an auditor to take pen and paper and document some of these on a government facility?
I know.
Just know there must be truth in it. There must be truth in it. These bed sheets must have looked old. Do you think one can fail to differentiate between new and old bed sheets?
And moreover, taken to... and the auditor says they only take them for laundry once a week.
So you look at them, they are saying, "Ee," but you responded. The auditor tells you you have old bed sheets, but you take them to the laundry once a week. And you are saying, "Ee," but they gave you the report. You even had a management letter. You had an exit meeting. Why didn't you respond? The issue is this practice must be there.
And you even have water areas.
So, honorable colleagues, the fact that now you have bed sheets, because we would have told one of these good people here to donate you some bed sheets. People can help, because we want you to protect the gains seriously. So with these old bed sheets, my dear, let's proceed, honorable colleagues. The entire ward has only one wheelchair that was donated in 2024. Therefore, the ward never had any wheelchair for the past 10 years. You had a wheelchair that was donated in 2024. My interview with the staff of the unit reveals that it requires at least 5 wheelchairs to move patients that are critically ill to enable them walk independently. Tell us about the efficiency of this one wheelchair and what you used to do before 2024 when this wheelchair had not been donated to you. how did you manage the patients in absentia of a wheelchair?
Thank you, Chair. This is very true that the entity doesn't have enough wheelchairs, and in that case, there is sharing. The departments share until recently, actually, when we got some from donation and also Ministry of Health, that every department now has its own wheelchairs. But before that, departments were sharing. It would work like any other taxi. It drops a patient here, it wheels somebody to another place.
With that congestion
like
of yours, won't that taxi get get mechanical challenges?
It was, it was.
A wheelchair. Honorable colleagues, the designed changing room for the students was modified from patient bed, and it's shared by all the students available for trainings. Tell us about this designed changing room.
Maybe there's typing error, but as I say that the hospital doubles as a training entity for MAST. The original plan of our wards and other units never had tutorial rooms and changing rooms for students. Therefore, when the university came up and absorbed the hospital, they repurposed very many small places. So this was just one room which they repurposed as a changing room for all students. Unfortunately, they are doing it in turns, as you've seen. Both female and males are changing from there. These are students from MAST.
So they change from the same room.
Yeah.
Why don't you improvise for a tent? One category. Because modalities of using tents is a common practice in Mbarara, because it is risky. How do you make males and females use the same changing room?
Yeah, it is
Madam
risky.
Hospital Administrator, have you taken care of the girl child? The boy child can improvise always, but you know, the boy child, the mental. Madam Hospital Administrator, this is something you should look into. How do we have changing rooms for both, that accommodate both males and females? How can that, actually, if there is anything that should be looked into with immediate effect, it's that it is far below the required standard. When in our homes, can you make boys sleep with girls? Adlat, can you? Or you have future plans for those ones? For you, how? Because it is pure unacceptable. Let's proceed. Lastly, when you look at the staff unit, acts as a store for consumables, changing room, and also store for staff food. The staff unit acts as a store for consumables, changing room, and a store for staff food, for food stuff.
I think there was a typing error here, but the truth is there are two rooms. One room is a changing room for students. Another one is basically a changing room for staff members when they are reporting and when they are leaving.
No, we are talking about the consumables and the food.
Yes, let me look at it.
The consumables and the food being stored in the same place.
Oh, yes, I have seen it.
Did you see that?
Yes, I've seen it, Chair.
But is it true? Because you know the practice, even before you look at it, you know.
Yes, I know. I know that is a very congested place. And yes, it can happen. I don't want to deny this. It can happen.
So, tell us what is in the category of consumables? If one speaks about consumables in the hospital, what are these?
Yeah, usually consumables are gloves, the needles, syringes.
So you store them
cannula,
with food.
and the condoms, yes.
So you store them with food.
But ideally, this food.
I think these are the reasons as to why the IGG decided to come to Mbarara. I think.
I don't know.
You know, arising out of these so many, I doubt, because if the IGG had come for issues of corruption, some of you would have been apprehended. But I think because of some of these reports and the complaints about the state of the hospital, I mean, it forces anyone caring to come and see what exactly takes place in the area. So, honorable colleagues, good enough we have some of your representatives from here. I mean, your representatives in this room. Ibanda, Mbarara is here. Please, as we do, add our voice to ensure that Mbarara Regional Referral Hospital meets the standard, the basic standards of a regional referral hospital. And you are yet to be upgraded to a national referral hospital. How can that happen when you're operating like a district hospital?
Upgrade would sort all these things.
And I mean, you don't qualify to be where you are. Because an upgrade means, yes, you satisfactorily serve as a regional referral hospital. So be upgraded to a national. But I'm seeing an accelerated promotion from a district hospital to a national hospital. Because by the virtue, how can we have a referral hospital keeping consumables with the food? How do we share changing rooms, ladies and I mean males and females? Where do you find that? So we should appreciate that much as you are operating as a regional referral hospital, still the facilities don't match the standards of a regional referral hospital. The congestion is much, you need more facilities. So if you are to be upgraded, that means the budget must shoot. If one gave you an open check, how much money would you need in terms of budget from Mbarara Regional Referral Hospital, not national, for at that level, for you to operate somehow, not closer, but to a standard that is of a regional referral hospital? How much money would you need?
Yes, thank you so much. Of course, this goes with the human resource capacity
All that.
and infrastructure and, of course, consumables, as we said. At least I would need time to analyze this. I can't just say it off there. But if I give an example, Chair, recently we did the needs assessment for on-red drugs. And we found the hospital needed 53 billions for on-red drugs.
53 billion for on drugs. And how much do you get for drugs as of now?
We are getting 2.8.
2.8 billion to serve a population of 6.7 million people, plus the refugees.
So if I just make an extra operation, I mean, you can see if we have to take away all those tents and remove all these structures, it needs a lot of money. We would sit and look at the figure.
The 53 billion is only for drugs and
only drugs and consumables.
How much money do you get under your budget for repairs and maintenance, for repair of these machines? How much money do you get?
Yeah, we've been getting 166. Yes, but now this budgeting, they have allowed us to get 450 millions.
Is that enough for you?
It's not enough, but we are coming from far down. We do appreciate.
No, the issue is not coming from far down, but it's serving the purpose. Because with your 100 million, the other time when you appeared here, you were at a level of where you cannot even repair the bulb you are talking about because of that inadequate budget. You know, you don't get money for the sake. We don't just throw money to somebody. It must at least somehow, to a certain percentage, serve the purpose. Now we are asking, what would be the most appropriate budget for you when it comes to repairs and maintenance?
Yeah, thank you. Do you want to add a voice, our planner? Yeah.
Thank you, Chair. For the budget, actually, maybe Director, this financial year, For medical equipment, it is 201 million.
This year,
Yes,
201.
but with these increments that we've been having, next year the budget for maintenance of equipment has gone up to 1.165 billion.
1.165. So that would be somehow, would serve the purpose? What would be your appropriate budget if one asked you for repairs and maintenance of this equipment? What would be relatively suitable budget for you to say that at least we can relatively survive?
I would put it at 3 billion, including, because we have heavy machinery like the oxygen plants. We have a number of oxygen plants in the hospital. We have a lot of generators there. So these take a lot of money when it comes to maintenance.
So, honorable colleagues, we take note of those challenges. Then we have the issue of maintenance of medical equipment. We've talked about this. This is the area we've been handling. You have utilization and maintenance of medical equipment and ambulances. You told us you have how many ambulances? How many ambulances do you have?
We have 2 ambulances.
Which type is that?
We have a type C, and
what does type C do?
Thank you, Chair. Type C is the most advanced ambulance in this country. In it, in the same ambulance, it looks like an ICU room because you have oxygen, you have a ventilator, you have a monitor, you have water running, you have defibrillators in case you got cardiac arrest.
Is that type C, and the other one is type what?
Type B.
Type B. Are those 2 enough for Mbarara Regional Referral? Can you serve the community with those 2?
The beauty is that surrounding districts have ambulances.
Good.
And
So
we are
that
in
means-
charge. The person in charge of regional ambulances sits at the. So we coordinate, including also police and Red Cross.
You have some of this equipment, that is 3.443, the equipment that is lying idle. According to the auditor, according to the interviews held with the management, the CT scan was not in use for more than 1 year. Did you speak about the CT scan?
Yes, we did.
Have you repaired it? Is it now operational?
Yes, please, 100%.
So we take note that you spent 1 year without a CT scan. What's the impact of that?
Madam Chair, actually, the hospital has 2 CT scans, and the one which took 1 year, it had been provided with a printer. It had issue with a printer and work table. So we continued serving until this one also eventually they got rectified, the printer and work table.
Then we have this central patient monitoring station. The item is not in use because it's lacking a functional cable.
Actually, that wasn't the main reason.
What was the reason?
The central processing unit is from a company called Eden. And the monitors of which it was supposed to serve, they are Mindray. I have a technical person here. He can finish on this.
No.
So we found
for us whether the the central patient monitoring station is of which type, what we want to understand. Why wasn't it operational? That is the whole issue. Because at the time of purchase, you ought to be knowing where to get what. So the patient in Mbarara doesn't want to know where you pick what. Yeah. For you, the time of purchase, you will know that for this to be fully functional, I must pick this from here and pick this from where to have it function. So response?
Yes. Thank you, Madam Chair. Now, the central patient monitoring system was not compatible with the patient monitors that were within the different rooms of the ICU, because of the nature of the manufacturers. And
what is the impact of this?
And this was actually, it was even a donation. The impact of this is that, you know, we need, if I look at medical equipment, technology keeps on advancing every year. Originally, if you have to see, each room always has a patient monitor. With the advance in technology, there was an introduction of a central patient monitoring system which summarizes all the data that is on the different patient monitors in these different rooms. So, after that advancement in technology, we are given a central patient monitoring.
Who gave you?
Ministry of Health. Ministry of Health.
But do they do an assessment in your hospitals before some of these machines come? Because as you give me this unit, you ought to be knowing what the machines that I do have. We are finding it a challenge where the ministry gives machines to different health centers and they are idle because of compatibility. This is a heavy investment, money is invested, but when it goes on ground, systems can't communicate. So when the Ministry of Health comes to the committee, they'll have to tell us, because the assumption would have been somebody comes to Mbarara, makes an assessment, and gives something that fits the purpose. If not, I mean, give the whole system. Because it doesn't help for you to bring a central system that cannot communicate to these others. Then what is the use?
But Madam Chair, I think this will not only be the responsibility of Ministry of Health, but also the user entity. You've been provided with a unit that you know is not compatible with what you have. Have you expressed any disappointment by saying this unit is going to remain idle here because you are aware we cannot use it because of the shortcomings, and have the unit returned back? In fact, here we would be applauding you for having not wasted resources in terms of assets like that. Maybe they would have gone elsewhere. They would have gone to new units being prepared such that the connectivity is availed. So when you also keep quiet and just receive, the auditor will definitely query you. You should have, from the onset, said, this one is not compatible with us. Take it back. Or support us to ensure connectivity, to make sure that these systems speak to each other.
Yes. So much. Actually, that's what happened. You see, when these gadgets come, usually a technical person follows it and connects it, then it sort of gets commissioned, the users get trained. When this happened, we said, yes, it won't help us. And actually she asked that what did this mean? It meant that it restrained our workers. They had physically to keep on monitoring each patient in an ICU physically. But we said, you can't take it away. We have the upcoming neonate intensive care unit. Let us take it there. And eventually Ministry actually brought another one, which is working.
You are talking about a neonatal unit incoming. This is the same building that is not, where budget is not allocated. Do you know what will happen?
No.
It is not the same?
No.
These are staff quarters. Is the neonatal complete?
It's getting done.
When do you think it will get done?
I need to check, because what they are doing actually, they are just now installing the gadgets.
Then that
it
can
is almost
serve the purpose.
done.
Honorable colleagues,
So have you already integrated this one as one of the gadgets getting into that one?
Yes, please.
Yes, but like you rightly said that technology is changing.
Yeah.
I hope those who are supporting us in that unit might not say this one is obsolete. Now we are bringing our new one to match the demands of the day.
Honorable colleagues, with these other areas, we shall take you by your responses. It's about old equipment that's not in use. Mbarara, we are done with Mbarara Regional Referral. Yes, Honorable.
Thank you, Honorable Chair. I just want clarity. Just go to page 14 of your accounts. If you are there, transfers received from the consolidated fund.
Honorable Shabe, you can chair for these few minutes as I take this important call, you know. It is from not from your state house, but from ours.
Madam Chair, do you think I can chair from here?
Yes. You don't regard still the seat from your first start.
Choma?
Thank you, Chair. Honorable Chair, page 14 of accounts. While this issue was raised, the explanation was not clear.
Was not.
I still need an explanation. Where you had budgeted for 16.5 billion was your initial budget. You did not get any supplementary,
No.
but you ended up receiving 17.2 billion. How did it come? And how did you apply it, given that you received much more money than you had budgeted for?
Shortage.
Accounting officer?
Thank you, Honorable. Like I said, the experience, I don't know how you are not getting it, but
Can Honorable Choma clarify so that
I'm not getting it because
he doesn't.
you see, in the government, the essence of budgeting is to identify those outputs and activities that you want to undertake. Okay?
yes, sir.
And I'm sure this is what you did. But you were so lucky that for you, while you wanted 16.5 billion, which was given to you, you even received much more by 707 million, which you had not budgeted for, which was received over and above what you wanted. So two questions. One, how did this come? How lucky were you that you received 707 more and above what you wanted? And the fact that you had not budgeted for it and you did not return it to the treasury, because I have not seen anything like that. What was taken to the treasury is only the NTR. So how did you apply it? Thank you.
Actually, when we are making these accounts, I got the same issue.
Will you kind of speak through the microphone so to hear, because we are slightly far from you?
When I was compiling these accounts, I got the same issue. I tried to get an explanation from the accountant general who supervises us, because the actual performance was greater than, like you see here. So the explanation was that because we budget, and this NTR is already factored within our budget, we get a cash limit before collecting the NTR. Then we spend. NTR is later receipted after we have spent. So this figure is already incorporated.
My brother, now you are not talking to your figures. Because you look at the same line, the same column.
Page 14.
Yes,
Show
same
him where
column.
you are.
Yes.
Honorable Choma, guide us on
Yes,
which
it is
column.
page 14
That's where I am.
Column.
of accounts. Then the column of actual performance.
And
That's where I am.
Yes. So if you say it is already factored in, first
Yes,
of all,
yes, sir.
you know accounts really follow formats and standards.
That one I
And
know.
your referral hospital cannot be so unique that we will treat it from the rest of the MDAs, okay? And we have been handling other MDAs. Besides that, you go to the line of NTR. You
Yeah.
actually collected.
Yes.
And now, added to what you received, it is 18.3
18.3.
billion.
less than what you budgeted. budgeted.
Yes.
It is NTR is even less than what you budgeted.
Yes.
Information, Honorable Choma.
Yes,
Yes, I take
Honorable
the information.
You know, when I raised that issue, the same explanation came. Now, if we removed the total revenue, which takes it to 18, let's just go back minus NTR, go back to 17.231. You're collecting from the same basket.
Yes.
And what the basket provided you was 16. Before you collected NTR, but it provided you 16,513. But your actual performance was 17 before NTR came.
So,
Where
accountant.
did that additional? You could have been lucky. You are not among the only lucky people here. We have seen some luck come from other referral hospitals where they have just taken. You are not lucky. Maybe you could have been lucky.
Accountant, Madam Chair has returned to her chair. So
You finish with the item.
okay, thank you. So kindly let us know, did you receive more money from?
Did you get a supplementary, for example?
No, we did not.
How come? How can you explain this 700 million?
Because we even raised the mails regarding this issue and we got guidance.
Do you have those correspondences, given that for us we are an accountability committee, so that we refer to them? Would actually, it would be a big surprise that the accountant general would advise you to that effect, because even the formats he gives,
Honorable Choma.
the templates are clear. That column is what is actually received from the consolidated fund. Then the other one below is specifically for NTR. Added together, you get the total actual for your financial year. Then you start spending as you transfer the NTR to the consolidated fund.
Honorable Choma.
And I've actually gone through, I've even I've traced it. Okay, it was actually received. It was actually received in the cash flow statement. So,
yes, correct.
How lucky were you really?
Yes, Honorable Choma, that's what I wanted to give you information. It is good you've reached there. Now, you expended these funds. How would you expend what was not budgeted for?
This account.
And to understand it better, you see, because you are saying the accountant general advised you to add it to what is got from the consolidated fund. But when you look at what you transferred to the consolidated fund, cannot be part of the 17.2 in the cash flow statement.
No, it's separate.
Okay. So
we had a legacy discussion with the accountant.
The good thing is that you are saying it also surprised you, because I'm sure it is not your first time to prepare accounts.
No, it's surprised.
Perhaps you could do.
Because my thinking was
yes,
maybe it's a mapping problem in the system. But for them, you are insisting.
But you were lucky. You actually received the money, so you would tell us how you used it, since you have not, you have had that building which has stood for a very long time, whatever. But give us those correspondences between you and the accountant general, so that we take it up from there. That would really help us.
Honorable colleagues, Kawempe is already here. I beg that we discharge Mbarara Regional Referral Hospital.
Chair,
Yes.
this is a serious case. It's a matter of finances, and it seems the accountant is very reluctant on answering the question, a very pertinent question that might even require him to return to this committee to answer the same. He's so reluctant, Madam Chair. He never budgeted for 700 million. He received the extra 700 million, and I can't explain anything about it.
Yes, Honorable Basman.
He says he wrote a correspondence. Was there a reply? I didn't maybe hear him well say whether there was a reply. Maybe that would also be of interest to us.
So he has not even presented the correspondence.
Yeah, and, you know, and that's why we need we would want to get both, if they exist anyway. Through you, Chair.
Honorable colleagues, let him provide the relevant documentation seeking for clarification of that on that 700 million money. Those documents should be submitted to the clerk by Tuesday next week. Honorable colleagues, we discharge Mbarara Regional Referral Hospital. Want to thank you for coming before the Public Accounts Committee, and we appreciate the duty of service to the country, aware of the challenges that you do face, some within your control, others outside your control. We can't commit to the country that you can provide quality and standard medical care to the people of Mbarara. Those are the 12 districts and 1 city, that is Mbarara City, considering the challenges that you do have. We take note of the staffing gap of 26.4%, that is far below average, compared to the population of 6.7 million that you do serve, plus 2 refugee camps. We also take note of the delayed construction of a 32 staff unit for the staff of medical staff of Mbarara Regional Referral Hospital, and this comes with the challenges of, first of all, our medical staff moving long distances, and also, I mean, this contributes to corruption. I told people complain that you charge for the C-section and the least you do is 500, though it is not receipted and it's not part of the consolidated fund, but that was an allegation. So we cannot commit to the fight against corruption when, first of all, we don't give the basics to our staff. This 200 payment, the salary of 200 consolidated to the lowest staff, that is too little on our computation. You pay a cleaner and a driver 825 shillings per hour. I don't know what that can be used for, but it's far below the average. And also, we note of you admitting patients in a tent. The IGG came and inspected the facility and only encouraged you to get a bigger tent. Sir, for us who cannot be part of that chaos, our prayer is that you are given money to put facilities that serve the purpose of a hospital. A tent has never been, I mean, we cannot accommodate patients in a tent. And you ably said that even mothers who have given birth are also part of the ones that are accommodated in a tent as a ward. That is purely unacceptable and far below standard. We take note that the hospital is 90 years old and this country got independence in 1962. You have structures that are as old as 1943. I don't know, Basar Rasman can advise on whose regime was that. I don't know. It was during the colonial time. So it's our duty. I mean, we take note of the underfunding, that is the inadequate budget for Mbarara Regional Referral Hospital. 17 billion to serve the 6.7 million is purely out of range. This is very unacceptable. You've given an indication that if you were to, first of all, say in the line of medical, if you are to give people medicines and these other supplies, you have a budget of 2 billion, 2.5 billion, and the requirement would be 50 billion. You see, so in most of the areas we are performing far below standard. So we shall do our part as leaders, but also you as the hospital administration, we employ you to do your part. We take note of those changing rooms where males and females use the same changing rooms. We take note of the congestion, but there are basic standards, keeping consumables with food. How do you keep, gloves, condoms with the food? Who eats the food that is kept closer to condoms? Which standard is that? So, honorable colleagues, with those closing remarks, we discharge. These are our colleagues from Mbarara Regional Referral Hospital. You have not taken tea. We still have tea. It's cold out there. I don't know how you came to this place. I don't know whether you came by bus or you used a uniform means of transport, but we wish you safe journey as you get back to Mbarara. Coupled with all these challenges, and you have your representatives, the MPs here, you have Ibanda, you have Mbarara, They have represented you very well in the committee. Your issues have always been presented. The issues of budgeting is outside their docket. But we commend you for the improvements in the theaters, but also pay attention to the neonatal. You said it is going to be improved. That is our prayer, because it is an area that calls for some urgent attention. You know what the neonates go through. It's an area that we need to pay attention to. So we shall still say Mbarara is an hospital that is also in, should we say they are in HDD or ICU? So you are equally sick. The hospital is sick and it needs urgent attention. Honorable colleagues, these colleagues of ours, the MPs, will see off our guests. We have lunch. The fact that they are from Mbarara, give them lunch. It's take lunch. You can even sleep around as long as you have a budget line for that. But for lunch we have, but for accommodation we don't have. So Jane masses, as you get back to Mbarara, greetings to the people of Mbarara, Abanyabuzali na Abanyamukago. We shall ensure that they are served better. Thank you. Meeting is adjourned as we wait for 10 minutes break. No, 5 minutes break. We receive Kawempe. They are already here. Kawempe National Referral Hospital. Thank you. Honorable Bataringaya and Choma, CEO of your team from Mbarara.
UBC, inspiring Uganda.